Okay. I just want you to sit still, okay? Today we're just going to brush your teeth, and then we're going to floss your teeth just to show you how to do it the right way, okay? Okay, so I'm just going to cover you up so that we don't get any water on you, and then we'll start. Okay, so I hope you don't mind my chewing gum. So what I'm going to do is just put my gloves on. Okay. Because I know you're allergic to latex, so I took that into account. Okay, so first thing I'm going to do is put my hair up. Just so that my hair does not get in the way of the procedure. Okay? Okay. Okay. Okay, so you can just open up for me. It's perfect. Okay. I'm just going to use this mirror here just to be able to see inside your mouth better, okay? So I have you open. Okay. So I'm just going to poke it in there slightly just to see if there is any holes that you might have. Okay. There we go. And if it hurts a little bit, sure, you could just let me know, okay? Okay, so far I see that you have just a little cavity, might be. So I'm going to see if we can get an X-ray later, just to make sure that it doesn't go too deep. Okay. Okay. So I'm going to start scraping some of the debris we have, just to make cleaning your teeth a little bit easier, okay? I'll try to be as gentle as I can, okay? Does it hurt? Okay, good. Trying to be as gentle as I can. Okay? just going to dry the side of your mouth, okay? Okay, open. That's good. So I've been trying to get you to stay away from the sweets. So I hope that instead of eating chocolate and anything that sticks to your teeth, it's probably better that you just substitute any sweets for like an apple or watermelon or things like that, just so that we can avoid buildup. Because what this does is, even if you brush your teeth, sometimes we can't always get everything. And we tend to not brush well enough, okay? Okay. So, okay. So, I'm just going to brush very gently, okay? Just so as not to be too rough. Okay. Open. Thank you. And what I'm going to try and do here is just sure to dislodge anything that's sticking to your teeth, just so that there's nothing left that can possibly decay the surface of your teeth anymore. Okay. Open. Good. Okay. Okay. So, open. Okay. Okay. Very good. Okay. Got some stubborn. There we go. Got it. Okay. All right. Let's try to go back in there. Okay, open. That is just great. Very good. Very good. Very good. Okay. I'm sorry if I'm chewing loud. I have a habit of forgetting that I'm working on a patient. I start to chew louder. Oh, you don't mind? Okay. Well, that's good. It's good that you don't mind, because I tell you, sometimes I get a patient and they're just like, hello, Dr. Melbourne, I'm still sitting here. I have to remember to just bring it down a notch. So what I'm doing now is I'm just scraping the surface here, because you have a little bit of the orthodontic cement left on from when you had your braces, which is completely okay because all I have to do is I just gently scrape it off there, okay? And once I get it off, that is it. Sometimes what happens is the dentist might put too much at the time, but then after a few sessions of deep cleaning and scraping, like I'm doing right now, it just comes right off like I'm doing right now. Okay? Yeah. So you don't really have to worry about that, okay? Okay. So what I am going to do today is just floss for you. Okay, I'm going to show you how to floss the proper way, okay? And it's just really very simple. Okay, so the first thing you want to do is wrap it around your finger. I prefer to just wrap it around the finger twice on the right hand, okay? Then you're going to wrap it again twice around this hand. That way you have a good little grip right here, okay? Okay, it's open. So then what I do is I'll stick it between the teeth here. Yep, like that. And then up and out. Then you move it down the line. So then you just curl once you're done. And you move this finger to the side. And then you go to the other side. Like so. And then you curl it and move it again, like so. Then in, out, curl and move it again. And as you're moving, this side is getting a little shorter. Just so you don't put the debris back between your teeth, you want to be sure to move it, okay? So you put it back in that way. And then you move it again. And then once you get to the end, of course, you can just get another piece, okay? And we're just going to finish this one. Here we go. It doesn't hurt, does it? Okay. Here we go. That's perfect, okay? Okay. So, I'm just going to have another look just to make sure that we got everything, okay? And it seems that we did, which is perfect, okay? I think what we're going to do next time is, yeah, exactly. And I noticed that this time, but I didn't want to get too deep in that little, it seems like we might need a filling on that one. And I think what we're going to do is go ahead and remove your molar on that side too. Because if not, it's probably going to cause a little bit of an issue sometime down the line. And that is not something that we want because that can turn out to be very painful, okay? Very painful. Okay. Yes, because what can happen is if we allow the molar to continue to grow, it can cause what's called an impaction. It would cause your teeth to impact into each other, and that's not really something that you want. It can be very painful, okay? And in some cases, some people have to actually get their molars cut out of their mouth, and that's not a route that we really want to go, okay? Okay. Yeah, I don't see a problem on this side, but it doesn't mean that it won't develop into an issue because I see that both are forming on the bottom here. Yeah. On the top, it seems to be growing in just fine. But we'll ask your mother, and if she feels like she wants to just go ahead and take it out, then we could. But depending on who you talk to, some would just say leave it until it starts to impact, like this one is sort of leaning in, and that definitely will impact. Okay. So, yeah. But it seems the braces did a good job, so we won't have to really go back in and fix that for you, okay? We don't really have to, go back in and, because when we put the retainer, you had the newest retainer, the most updated, and yeah. So you had the most updated retainer. So what it did was it kept your teeth together, but it seems that the molar that's growing in and impacting this back tooth is actually shifting it, okay? And that's not something that we want, because if it shifts it, it's going to completely sort of mess up the work that the braces have already done. And we don't want to do that either, okay? So what we're going to do is we're going to have to schedule you to have that removed. Since it's partially out of the gums, we can probably try and pull it out. But if it's not, and if it's not enough where we can just pull it out, we might have to surgically remove it, okay? And yes, we can indeed put you to sleep for that procedure if you would like. And then, of course, we will prescribe you some medication, okay? Alright, so, okay, so just to recap, we cleaned your teeth here at the top, okay? I'll just wipe that for you. Okay, so, alrighty. Okay, so just to recap, all we did today was we just cleaned your teeth. We did a full prophylaxis on you. Okay, and what we're gonna have Katie do for you is just refit you for a retainer. But we're not going to have you wear that retainer right away. We're gonna have you continue to wear the same retainer that you've been wearing, okay? Just until we take out the molar, okay? So the reason you don't want to put the new retainer in is it will sort of shift your teeth into an odd position, and we don't want that until we actually take the molar out here that's impacted, okay? So the next appointment that we're going to do is see if we can attempt to pull it out, and if we can't, we are then going to just surgically take it out. And you don't have to worry, because you're going to be asleep the whole time, and you really don't have to worry, about it hurting, okay? I just saw something here, and just get, okay. So you won't have to worry about it hurting at all, okay? You're going to be completely knocked out, okay? For about 30 minutes maybe. So before you leave today, we are going to just fit you just to get it ready, because once we take it out next weekend, we don't want you to have to come back. We want to just automatically have it ready for you, so you can treat for pain for about 2 days, and then once the 2 days pass, you can actually put the new retainer in, okay? Okay, so just pass me her chart, please. Thank you. Okay, so open up just so I can see. Okay, that looks perfect. Yes, okay. Alright, so we're going to get you some water. Okay, and you can just sit up and drink some water. Oh, okay. Okay, perfect, okay. Alright, so once you leave here, all right, I will be giving your mother the full schedule. I will let her know exactly what's going to be happening once we go to take out your tooth, okay? You don't have to worry about anything at all. Your insurance is going to cover everything, and I also will write you a doctor's note so that you can miss a few days of school, okay? So you don't have to worry about it at all, okay? All right, so once you leave here, you can just go ahead and go straight home and brush your teeth as you normally would tonight, even though we just cleaned it just now, okay? And try not to eat any candy between now and the day that your appointment will be scheduled, okay? Just to avoid opening up that cavity that I do see starting to form, that we're going to sort of take care of after your surgery, okay? So, if you have any issues between now and the day of your surgery, please feel free to give me a call so that we can have you come in right away, okay? Okay, and you have a good night.